Hello again, Dr. John Webster here. Welcome to my day. I want to talk about what's commonly known as osteoarthritis. If you've noticed, as we get older, most of us get shorter, and I want to explain the anatomy on how that happens. So I'm going to focus the camera. This is a vertebrae. This is an example of a normal disc. This is an example of a normal vertebrae, and then this is an example of a normal nerve. This is how you are early in life. And so, just so you know that in your early 20s, perhaps, after you've had maybe an accident or played sports, the disc material is not quite as thick as it was back here, and the nerve is still doing good, but you're not as full of yourself as you were back here. Now, so that's phase one, or the beginning of the problem. Now, this is phase two. You can see now the disc material is not nearly as fluid as it was. You can see that there's spaces here that the spurs have formed. The reason the spurs form is because the bones get too close together, and there's a scientific response to that. You can see the nerve here is not nearly as large as the other nerves back here. So that nerve is not able to carry as much information and energy to the different cells in the body. And you can see there's a disc bulging right here. A lot of folks have herniated or bulging discs, sometimes even a ruptured disc. So this is considered phase two. Further on, as we get older, we get even shorter. Now, this is considered phase three. Look how the discs are almost gone. The spurs are huge. And look at the nerve. You see how frail the nerve is. So if that nerve is carrying energy and information to some part of your body, you know it's not going to be as healthy as it was back in the beginning. So now, I want you to know, as a chiropractor, when you get regular visits, I try to open these joints as much as I can for you each visit. And then I want you to drink water because your disc need a lot of water. And then I want you to go over exercises and stretches and just be more aware. One of the key indicators to longevity is flexibility. And when your spine begins to close down on itself, like we see here, you lose flexibility. So keep your joints open as much as you can. And of course, if you're having issues in this area, call your chiropractor. Thanks again. Bye-bye.